Evidence-based nursing practice is what I'm going to be talking about tonight, along with the article from Caterpillars to Butterflies. Evidence-based nursing practice is basically the wave of the future of nursing. Everywhere you look nowadays, there are articles posted on how to improve nursing care through evidence-based practice. As a nurse educator, you're at the front line of distributing a new change of policy or practice or procedure to the staff. Depending on the complexity of the change that will need to be implemented will determine how the change is actually disseminated to the staff. For example, is this a simple procedure that just a read and sign is adequate enough to get the information along to your staff? An example of this was the implementation of the scrub caps on my unit. So the scrub caps are to be applied to all saline locks and all ports on IV tubing. Research has demonstrated that they do reduce the risk of infection. Another example of an evidence-based change is the new sepsis protocol that was rolled out at Strong Memorial Hospital. There was a mandatory education module that was sent to the entire nursing staff as part of your yearly pediatric education bundle. So the staff was given this module to do. Along with the module, there was a teaching station at the yearly Pediatric Skills Day. And the annual Pediatric Skills Day is mandatory for all nurses to attend. So therefore, the nursing staff was able to be educated on the implementation of the Pediatric Sepsis Bundle through the module and through the Pediatric Skills Day. And the actual pediatric module is actually yearly education that is done for all nursing staff. At Strong Memorial Hospital, evidence-based practice is incorporated into your yearly evaluation. What I mean by this is to get a meets expectations or exceeds expectations on the portion marked evidence-based practice. You must complete an evidence review worksheet on a peer-reviewed article of your choice that you have found. The Journal Club peer discussion occurs during the nursing huddle, or it can occur anytime that there is a nursing leadership member available. The article is presented to the on-duty staff at the time, and questions is allocated for after the presentation. There is a binder where all the evidence review worksheets are located to review if you were unable to be available for any of the presentations that did occur. And like I said, this is part of your yearly evaluation, so you have 1 year to do your evidence review journal. In the article From Caterpillars to Butterflies, it discusses that step 1 is to detect any barriers regarding the implementation of evidence-based practice. I feel as a nurse educator, it is your role to break down any barriers regarding the implementation of evidence-based practice. I feel in my own unit that there can be negativity to the implementation of a new technique or practice. Not everything, unfortunately, gets rolled out and goes smoothly with being implemented. There's that saying, well, that's how we've always done it. Even though this is true, that the old technique might not be the best technique anymore. So you might have to adjust and upgrade your nursing practice. I also liked how the article stated that you need to form a partnership and engage your leadership. I think that this is definitely true if you want to try to implement any evidence-based practice on your unit. Thankfully, I have the support of my leadership and involve them in planning my yearly Pediatric Skills Day. So leadership is there to help me make sure I pick the correct date that will work best for all the nursing staff, along with any topics that they want taught to the staff. They reinforce to the staff that it is a mandatory requirement that they do have to attend, and they also are able to schedule nurses during the day if they are working. They break out the schedule so that as many nurses as possible can come to the Pediatric Skills Day. It's usually a 3-hour day, sometimes unfortunately due to patient acuity or how many patients are entering the emergency room. Sometimes people have to leave a little early, but they usually try to have it so that there's enough nurses on that are covering the nurses that are going to the Pediatric Skills Day, and then they'll flop throughout the day. Without the support, it would make facilitating my skills day a lot harder. So I do appreciate the fact that I do have my nursing management's backing on this. And I think, as I stated before, that this is important when you want to try to implement any change, is that you first need to get your leadership on board before you can start working through the process of presenting it to the nurses that you work with.